Hi, I am April Toh, a radiographer from SGH Radiology Department. I am also a mammographer and I perform mammograms on women. In the next few minutes, I will show you a basic understanding of the different stages of breast cancer. I will explain what is a mammogram and its importance in detecting early breast cancer. I will show you how a mammogram is done, and finally, how it can save your life. Breast cancer is the most common cancer in Singaporean women. Every year, about 1,300 women are diagnosed with breast cancer, and between 200 and 300 of them die from it. Women of the three major ethnic groups in Singapore, that is Chinese, Malay, and Indian, are equally affected. Breast cancer can affect women of all age groups, but is more common in those who are 40 years old and above. The breast consists of fat tissues and milk-producing tissues called mammary glands. The ducts of the mammary gland, usually about 15 to 20 of them, join together, leading to an opening called the nipple. There are 5 stages of breast cancer. Stage 0. At stage 0, the breast cancer is non-invasive. There is no evidence of the cancer cells spreading from the breast to the normal tissues nearby. 100% of the women diagnosed with breast cancer at this stage live for at least 5 years. Stage 1. Stage 1 means the tumor is small and less than 2 cm. At this stage, the cancer is confined to the breast and the lymph nodes are not affected. 100% of these women live for at least 5 years. Stage 2. In stage 2, the tumor is between 2 and 5 cm in size and has not spread to the lymph nodes or the rest of the body, and 86% of these women live for at least 5 years. Stage 3. In stage 3, the tumor is more than 5 cm in size and has spread to lymph nodes on the same side of the affected breast. About 57% of these women live for at least 5 years after being diagnosed. Stage 4. Stage 4 breast cancer is the last stage. The tumor would have spread beyond the lymph nodes to other parts of the body. The 5-year survival rate in this stage is 20%. I hope my illustrations have helped you better understand breast cancer. You may have heard of the use of mammogram in detecting early breast cancer. So, what is a mammogram and how does it help in detecting breast cancer early? A mammogram or mammographic examination is the X-ray of the breast. It is an effective way to detect small lumps, which may not be felt by our hands. It serves to detect breast cancer early, thereby allowing for more effective treatment and increased survival of patients. How is a mammogram done? This is a mammographic machine with a carbon cassette holder and a plastic compression plate. The breast is placed on top of the cassette holder. The mammographer will adjust the breast to ensure that all breast tissues are within the cassette. She will then adjust the plastic compression to apply adequate pressure to compress the breast. Once the picture is taken, the compression plate will be released immediately. This step is repeated another 3 times in the procedure, twice on each breast, and each time the compression takes between 3 and 5 seconds. It is important to compress the breast during mammogram because it prevents movement and spreads out the breast tissues to achieve good image quality so that the radiologist can make a more accurate diagnosis. At the same time, it also reduces radiation absorbed by the breast. During the compression, some women feel discomfort or even pain. Some do not. It depends on each person's tolerance level. The important thing is to relax so that the procedure can be done quickly. So even if there's discomfort, it is short-lived. So when do we go for a mammogram? There are 2 scenarios. For women with no symptoms, women aged 40 to 49 are encouraged to go for a mammogram once a year. Women aged 50 and above are encouraged to go once every 2 years. Women with symptoms of breast cancer should consult a doctor immediately. In Singapore, There is a national breast screening program called Breast Screen Singapore, which was established in 2002. Through this program, we aim to detect breast cancer early, thus allowing for more effective treatment, thereby increasing the survival rate of patients. Under the BSS program, mammograms are offered at subsidized rate to encourage women aged 40 years old and above to go for regular mammography. To enjoy the subsidized rate at BSS, you must be a Singaporean or permanent resident, aged 40 years old or above. You have not gone for a mammogram in the last 12 months if you are in your 40s, or in the past 24 months if you are above 50 years old. No symptoms such as breast lumps or blood-stained nipple discharge. Finally, you have not breastfed in the last 6 months. BSS is offered at X-ray centers in these SingHealth polyclinics located at Sengkang, Pasir Ris, Tampines, Geylang, Bukit Merah, Queenstown. For more information about the BSS screening, you can call these numbers. To book an appointment, call the SingHealth BSS booking line. Cancers detected through regular mammograms are usually at the early stages and will have better prognosis with treatment. If you are a woman 40 years old or older, do go for a mammogram regularly. Remember, the key to surviving breast cancer is early detection through regular mammograms. So, for you and for the sake of your family, go for mammogram today. I am April To. Thank you for watching.